Welcome to With All Due Respect. This is a podcast for women over 40 who are looking for sane, frank advice about their health and wellness, especially through and after menopause. I'm Amanda Thebe, a personal trainer and nutrition coach, and the author of the best-selling book, Menopocalypse, How I Learned to Thrive During Menopause and How You Can Too. I'd love you to join me every week as I chew the fat with some fab guests on hot topics that directly impact you. I also know the power of conversation is lost, and there's nothing better than sitting down for a natter with your mate and putting the world to rights. And that's exactly what I'll be doing with this podcast. We'll really get to know my guests, warts and all. I've made it my mission to help you by exploding a few myths and presenting you with plain, simple facts. These inspiring conversations will hopefully empower you to be a healthy, strong, resilient bitch, just like me. Before we get started, don't forget to hit subscribe and leave a review, and then visit me at amandathebe.com. And now let's get started on today's show. Hi, this week on With All Due Respect, I'm joined by my good friend and OB-GYN, Ardelle Piper. Hi, Ardelle.
Hi.
She's actually stood next to me for those of you listening on the podcast. Ardelle is based in Ottawa, but is visiting me in Toronto this weekend to pick up a sewing table. Don't ask, it's a long story.
It is a long story.
So I became connected with Ardelle. I think you said our friend anniversary was
January of last year.
Mm-hmm. Ardelle is really interested in raising the conversation about menopause in Canada, helping to support and educate women, and saw me doing a similar work from the patient advocate side. And we've joined forces in that respect. So you were educated at the University of British Columbia.
Yes.
And Saskatchewan.
Yes, I've come from the prairies. And so I felt really lucky to go to Saskatchewan for my obstetrics and gynecology training part. And then from there, went to Ottawa for my menopause fellowship.
Yeah, I've never been to Saskatchewan. It's sort of on my list of places to go.
Saskatoon is Paris of the prairies.
Oh, who knew? I didn't know that. I didn't know that at all. And so now you have a practice in Ottawa. I send women to you all the time who are based in Ontario because they can use their health card there. But we have both seen that there's a huge gap and a real issue in the support and healthcare for menopause in Canada. And we'll talk more about that later. But yes, I would like to start this podcast with you, if you don't mind, with you just talking a little bit about yourself and, who you are, why you're doing this, why you actually decided to be an OB-GYN and focus on menopause. What sort of got you to this place?
Yeah. Well, when I got into medical school, I loved the women's health side of things right from the start. And so it was for me a decision of, do I want to go into family practice and focus on women, or do I want to go through the obstetrics and gynecology route? And I really liked delivering babies, and I really liked surgery, and I really didn't care about taking care of men and children. Yeah. So it made sense to me that I could choose a specialty where I really could focus on women's health. And so when I got a residency training spot in Saskatoon, that was then my 5 years was delivering babies and doing surgeries. And when I was getting into my senior years, I followed in a rotation one of the family doctors in Saskatoon who ran the menopause clinic there. And I loved it. It was slower than some of my classmates liked. When you're in obstetrics and gynae, there's a big adrenaline factor, right? And you have to be definitive and decisive about a lot of the stuff you do. You're delivering babies, you're doing surgery.
You're bringing life into the world.
Yeah. And it's snap decisions. And so it attracts a personality that is really kind of go-getter that way. And I really liked kind of slowing down and talking to people and hearing their stories and hearing about the bigger picture of their health. And Dr. Vicky Holmes, who was my mentor at that time, and Dr. Thurza Smith, who was a gynecologist, I just loved the way they interacted with their patients. And so I looked for a menopause fellowship. There were only 3 across the country.
Right.
So this is part of the problem. And so in Ottawa, I came there for an elective and met Dr. Jolly, and immediately it was a good click, and I made plans to come to Ottawa and do my year.
So when you did your training in UBC in Saskatchewan, did you ever have any training in menopause? Was this something that was introduced to you sort of in your education, or was it when you actually started doing the job that it was obviously something that you were pulled towards?
I don't remember there being much about menopause in my med school. And of course, between moving across the country, I had those moments of going, should I hold on to all these books of all my curriculum and all my learning notes? And finally, at one point, I think it was when I was moving to Ottawa, I was like, oh, I'm never going to look at these again. But of course, I have moments now of thinking, what did I learn about menopause? But I don't think it was much during med school. And even in my obstetrics and gynecology training, I don't remember there being a big emphasis on it because so much of what we did was delivering babies and dealing with bleeding and hysterectomies. And a big part of studying for our exam, I do remember, was the big issues of the Women's Health Initiative. It was memorizing the numbers of different outcomes in the groups that were treated and not treated with hormones. And then it was some big concepts like, osteoporosis. And I remember when we would have practice exams and some of our staff would put in a question about menopause, people would get all rattled by it because there was so little that we actually learned on a day-to-day basis. And so I don't think that our training program did a really good job of menopause.
Do you think that the reason that is because, it's a phase of life? I know there's situations where menopause it comes upon women quicker and more aggressively than, but I'm talking generalized as a natural life stage. Do you think that it's overlooked because of that? And then potentially if we did consider it as part of a treatment plan, then it becomes medicalized. Do you think there's like a hard line to find, or a hard balance to find there? Or do you think it's more just down to the fact that nobody cared?
I think it's both, because when you look at what the culture was like before the WHI, there was a lot of attention paid to menopause. A lot of doctors counseled people about menopause and put them on hormones. Now, of course, we know that the feminine forever concept was the wrong philosophy, but it did get women at least treated in their menopause. And so I think that there was more comfort about that. And then when the WHI came out and physicians were not certain that this was going to be something that was safe, and then there wasn't a treatment for it, then I think that sort of slowly evolved into, well, if we can't treat this medically, if this is just a phase that you need to go through, then I think gynecologists were like, well, then the family doctors can just counsel that as part of your primary care. But the family doctors weren't learning much about it. And so I think it just sort of probably a combination of a whole bunch of factors just sort of dwindled down until when I was coming through my training, around 2010 to 2013, there was very little that was done for women in menopause.
Right. And we just filtered out and became invisible, which is one of the issues that we often talk about, right? That we're just not seen well enough. And so you've got to the stage now, you're in Ottawa, you have a clinic, it's fulfilling work, even though it can be frustrating at times, right? You see that there's a need within the healthcare system of Canada to change, and not just the healthcare system, overall perception in the workplace and everything, right? Like there is globally. Yes. But, we're in Canada, so that's why we're talking about Canada right now. What other problems do you sort of see, in not just the medical side of it, but the overall side? So I want to talk about advancements we've made next, but right now, what are the stumbling blocks or bad conversations or wrong plays in that you're seeing? I'd just like to know that from a doctor's perspective.
I think that because it's a physiologic stage, I think this has resulted in a lot of sort of confusing and conflicting ways then that you deal with that. It's a physiologic stage that we all have to go through. Thank goodness we're not having babies still in our 50s and 60s, right? It's in our best interests to be able to advance out of that stage, because as you get older, a pregnancy can have higher and higher risk to it. And from an anthropologic perspective, it's good for us to advance into different roles in our village, so to speak. So, we need to go through it, but that doesn't mean that women can't really, really suffer from that. And I think because it hasn't had enough conversation from the physician field, it's kind of then gone underground with women, where women then have not talked about it with their friends. Their doctor hasn't been asking them about it. And so then it has led to then this big problem of lots of women having problems with their menopause. Some of it can be simple fixes. Hey, if we do enough counseling with our patients about lifestyle and reducing alcohol and the importance of strength training, none of those are a pharmaceutical, but those all deserve a lot of attention. And then you get to simple solutions like lubricants and vaginal estrogens and talking about sexual function. That again, are pretty simple solutions.
Oh, but I get that though. And I get that because, you've been part of my community as well. You see the hesitancy of women to even talk to their partners about it, never mind their friends. That's one of those really sad conversations. Thank God people like Dr. Kelly Casperson are just running with this. I
love her podcast.
So many women are struggling and struggling needlessly because it's such a simple solution for that. But I hear you about the other players in the conversation that of almost like, I talk about the pendulum and I don't want to keep using that analogy, but it's just
it's a fair analogy.
It's a fair analogy that we've gone from having like no hormones to only being hormone driven to then having the natural fallacy people saying you should be able to like push through this and I'm not giving in to hormones. And I'm like, oh, for fuck's sake, can we just like stop? Like all of the solutions should be considered for this like balanced view. So I'm glad that like you're seeing it as well, because I think that once you start seeing a few red flags, they pop up everywhere, right? And I think when you become attuned to it, it becomes really easy to see people that aren't playing fair. Yeah, that's what I see.
And I think too, because there's such a variety of how women's menopause journey is for them, then that leads to a lot of just confusion amongst women themselves. So I've had women come to me who are having virtually no hot flushes or problems with their menopause, but then they've heard now this out there that they should be going on to hormones because it'll do good for them in the long run. And I'll still have to bring them down to saying, well, but what are your symptoms? Let's look at what your menopause is. Let's look at your risks. Let's see what your risk benefit analysis of that. And then I see the other side of that where women have been melting down. They describe their hot flushes as nuclear.
Oh, they are. They're horrible for some women, right?
And yet they've been not offered any solutions. And so they've been suffering in silence. So you get, because you have these ends of the spectrum and then a bunch of people in the messy middle, there is no one solution for how you treat menopause.
Yeah. And I so love that's your stance on this, because I do find myself a little bit conflicted when I see sound bites from very binary views of doctors and other people. And, what's really interesting for me is you said that there's women coming to you who have no symptoms but want to go onto hormones for their well-being. And we know that there's some benefits to going onto hormones, but we also know benefits from lifestyle factors actually probably outweigh them. We know that we know how important nutrition and exercise is for our longevity, like for overall health markers. And I think that when I'm talking about finding that information in the messy middle, it's like, it's not just a nice to have to eat well and exercise. It's actually essential. Yeah. Right. Yeah. And so you walk the walk as well.
Yeah.
She's a doctor who lives.
Well, and I try to explain that to my clients and say, this is why it's not coming out in the cardiovascular guidelines and such to say that a primary thing that we should be doing to prevent cardiovascular disease is hormones. Because if you do that, then you are sort of undermining all the importance of don't smoke, reduce your alcohol, exercise. Let's be not like thin focused, but let's be health focused. Let's be, looking at those things that are bigger determinants of your health on a broader scale. And so if we don't have those conversations, I'll say to my patients all the time, yes, we know that collagen, it has estrogen receptors. And that if this is why women who go through early menopause should be on hormones in their 30s and 40s, because you need it, because you're still establishing and holding on to your early bone mass and such. Yeah. But if you go outside, for example, and don't wear sunscreen for years, any collagen in your skin that you think your hormone therapy is going to hold on to as an anti-aging, I don't want a wrinkle, I've seen people who go through menopause and they just instantly age. If you don't protect your skin with sunscreen and you don't do all the right lifestyle things, your hormone therapy isn't going to stop you from wrinkling. Yep. Your hormone therapy will not stop you from getting heart disease if you are not practicing the right lifestyle things.
Yeah. Okay. It's everything. It's everything. And so the last thing I want to talk to you about the problematic messaging before we get into all the positive stuff, which is like where I like to go, is another message that I'm hearing, and I wonder whether you hear it, is that, we often hear women saying things along the lines of, I'm never coming off hormones because I'm in a deficiency. I hate that. I don't know how you feel about that word, but I'm in a deficiency and my body needs it for the rest of my life. Right? We know that that's not accurate. So can you reassure the people listening and watching, if it's on YouTube, that as we go into like the third half of our life, which potentially can be the half of our life as well, if we live long enough, do we need our sex hormones to survive and thrive during that time?
It's a different answer for everyone. And I think this is where the individualized approach to menopause is really important. Definitely some things like vaginal estrogens you can be on for the rest of your life, right?
That'll be me.
Yeah. And they make such an impact. There are new medications that are coming out that aren't necessarily a product you have to place in your vagina, but they're an oral medication. And there's talk about saying these are really good good solutions then for women as they maybe get into long-term care, or they have some sort of disability or something that's changing their mobility, or women who have horrible arthritis in their hands so they can't, put products into their vaginas easily. We should be talking about using these products for them, because recurrent bladder infections, you can die from
a UTI, right? It's horrible.
It's horrible. And not only that, but just like the day-to-day suffering of these women. And so we should be having solutions that look at those things in the long term. But when it comes to other things, I have women who should probably be staying on at least a low dose of hormone therapy, because their osteoporosis risk factors are really quite significant. And they're doing everything they can from a lifestyle perspective. And their bone mineral density is still just like, ooh. And I've had women who as well, whenever they come off their hormone therapy, either their hot flushes come back or their mood tanks. And it's like significantly changing their quality of life. Right. Fine, great. We should support those women. We should no longer say to them, oh, because you're a woman and you're 60, you have to stop your hormones. That's sexist and that's ageist. Yeah. We shouldn't do that.
And it's also medically inaccurate. Yeah. Isn't it? Right.
But there are also lots of women that, when I get them onto hormones because they need them, and they'll say, well, now what? Like, does this just delay my menopause? Like, how long am I going to be on this for? And I'll say to them, there's no rules, right? So a lot of women will kind of, as they get through their menopausal years, over 5 years, over 10 years, they'll taper down their hormone therapy. They'll come off of it and they feel fine. And then they're wondering, well, should I be staying on it because I have to? And it's like, you don't have to do anything. You don't have to go on it in the first place. If we have a discussion and I prescribe it for you and you decide not to go on it, no police is going to come to your door and say, why are you not taking your hormone therapy?
The hormone police.
Right? No, like I want women to be informed so that they're making a choice that is like, level-headed and not based on fear and not based on pressure.
Right.
And then everyone should be able to make their own choice within that. So no, every woman should not feel that they need to be going on hormones for the rest of their life, or they're missing some boat.
Yeah. And especially those women, like we talk about the breast cancer survivors who never have that option. And we know that there's other options available to them. So right, that's a really great clarification. Yeah. Okay. So now let's talk about the positive stuff. And I want to get onto right. So I've been talking about menopause reluctantly and, on purpose.
Enthusiastically.
That's the word. Yeah. I had a menopause moment then enthusiastically for, I think, 4 or 5 years now. Mm-hmm. And I have seen a huge shift in the conversation. I get a bit frustrated when I hear people say, nobody's talking about menopause. Well, no, go fuck yourself. Because we are, excuse me, I'm terrible at language, but it's like, no, we are. And people are listening now. And it's great. So that's one of the personal advancements I've seen. And I love it. I love the fact my husband talks about menopause, your partner does, my children do.
Yes.
It's great. In fact, the other day I wasn't very well and I got COVID again, but my son who's in university phoned me up and went, are you going to blame menopause for that too? And I went, yeah,
of course.
Well, you're the boss of me. But anyway, so he, it's a normal word in our conversation.
Yeah.
So you've come from the doctor practice side, right? So you've come from the side where there's only 3 fellowships in Canada. You're frustrated at the lack of advancement in the healthcare. Yeah. But you're also you've been at the beginning of the movement, right? So what advancements have you personally seen? Yeah. That have been fulfilling?
When I did my fellowship, so that started in 2013 to 2014, we were still at that time saying to women, as you get to 60, you should be off your hormone therapy. So if women were on oral therapy or transdermal therapy, didn't matter. 60 was kind of this benchmark because, again, some of the data and the numbers from the WHI have been poorly interpreted and overgeneralized, and people made the wrong conclusions for that. And so, this age factor of, as you get older, somehow hormone therapy is going to start becoming something, uber dangerous for you, resulted in us really trying to pull everybody off their hormones by 60. And women who were desperate to stay on them, we would try to take them off of their oral medications and onto something that would absorb through their skin, because we did at least kind of appreciate that maybe clotting factors through your liver are different than if you take it through your skin, and et cetera, et cetera.
Right.
So that was definitely, the way we went then. And after 2016, when some of these long-term results of the WHI came out, and it was shown that actually the women who were on estrogen only, and this is some of the old school estrogen onlys, they actually didn't have more breast cancer. The data even suggested potentially a little bit less. Yeah. And women who started younger did not have the same issues as women who were in their 60s and 70s. So that in itself then started the conversation again about saying we shouldn't be overgeneralizing anything about estrogen. The birth control pill estrogen is different than menopause hormone therapy estrogen, whether it's oral or it's transdermal, or it's vaginal. And I think this conversation has become more nuanced in the last 5 years of us saying, let's stop looking at these black box warnings that are on every estrogen product. Right. And let's try to appreciate that based on who you are, what your risk factors are, what your age is, what your symptoms are, we should be able to have a better conversation about what your menopause options are.
And the advancement you've seen is we're having better conversations.
Yes.
Definitely, aren't we?
Yes.
Yeah.
Yes.
And do you believe that, like, I think that the fear has been taken out of estrogen as being a carcinogen, as being something that's going to cause cancer, right? Like,
I still see it out there because I have a job, because people are referring to me, and the letters from people's family doctors will still often say they had a grandmother with breast cancer, and so she's been suffering and she can't even have intimacy with her partner anymore, but I can't put her on vaginal estrogen because of this grandmother with breast cancer. So people are still just flat out saying that because that's still what they believe. Right. And so that is a gap in knowledge, right? Those doctors aren't trying to be difficult. That's why they're sending people to me, is because they see that this person needs help, but they don't have the skills and the education yet to do it. Yeah. So I think that gap is now going to start closing, and that's kind of exciting.
And then how do you feel about people like me? I mean, obviously she's going to say nice things because she stood next to me, and she's going to get a big nudge off me if you say something wrong. But I just mean, so there's always been a divide between the relationship between doctors and patients, right? And I think you and I have crossed the bridge and met in the middle, like many others. I'm not saying we stand out there. Do you like that type of relationship that's happening where doctors are listening to patients, patients are listening to doctors that are educated, and then we're all now trying to advocate for one another?
That's the only way women's health is going to get any better. And I see this on the other, side of women's health too, with, periods. When you look at how much more conversation there is now about menstruation, that we should be talking about it. We shouldn't be talking about feminine hygiene anymore as if periods are dirty. And I've been really excited to see how younger people are talking about just that physiology, and and menopause is on the other side of that. It's like there's these pockets of just normal physiology that we still need to learn about, and women haven't been told about, and often is not necessarily discussed in your office with your physician, because they're looking for problems that they can fix. Right. And so I think it's great that finally the physician community is engaging more with people who are in other areas of wellness and saying, we shouldn't be in these towers where, if you're in menopause and you're having big problems, then you're over here, and otherwise you're over here, and we don't even talk back and forth. That doesn't make any sense, because hormone therapy for many women, if they're on it, should be part of the bigger lifestyle picture, right? Whether you're on it or not, actually. And so we need to be making those better communication pathways.
And I'm finding, I've definitely I haven't had a straight path to where I am, but I think that that's really important. I think that you can't have you can't stick your feet in the sand and create a stance that you're not prepared to learn from. And I've definitely shifted my views slightly, but without always trying to remain in the standpoint. And I think originally, I was very much every woman should be at least offered hormone therapy. I actually do still think that actually, but
it should be a discussion.
It should be a discussion, but I completely disregarded those women that never could. And when I've really listened to their stories, and they really can't go on them, even though that sometimes the message is that they can, I really feel like they need a louder voice. Even things like the Black community in menopause, the queer community in menopause. I'm learning on the job, and I'm loving it. It's been so great just to have my eyes made bigger about this. And so moving forward, so Ardelle and I are actually working on something that we're not going to tell you about too much, but we really have seen she's shushing to the thing. We see, I think, so for me, I definitely feel like there's a lack in the support element and the educational element as well as, and then the next step would be the medical side if needed. Where do you see menopause as a conversation moving forward? Where would you like to see it moving forward? What are your dreams and aspirations, my dear?
I think we need to be continuing the conversation that's already starting about menopause in the workplace, menopause in our environment around us, right? How can we be changing things in our culture that appreciate menopause? Right. Because so many women, if you're going through menopause and perimenopause, right? Because remember that stage starts earlier, so your symptoms can start earlier. That's in your 40s. And we're living to our 90s. So we should be having way more conversation about this. It shouldn't be taboo anymore to talk about your hot flushes. It shouldn't be something you hide because it's revealing your age.
Or embarrassing.
Or embarrassed.
Like, it's like the idea of failure. And I felt the failure. I understand that side of the conversation, the isolation and failure. So that's super important that we move on from that. I think we are, though. I think we're really making headway in this. And I think just generalizing the whole like idea of, like, for me, the whole ageist conversation as well is tied into this, right? The
anti-aging.
It drives me crazy. And so, but as an advancement moving forward, I think that community support, education I know that. So anyway, I know that we're going to try and be part of that because it matters to us, and with integrity as well.
Fact-based, science-based. So there's a lot of myth out there still, right? Ancient remedies and this herb, that herb. And there have been studies that show that some of these things can be effective, but the problem is how those products are created. And if the quality is consistent, where do women get it from? How much does it cost them? How much does it even help? Because the placebo effect is huge. And so women are really manipulated by all that. And so I think the only way forward is if we are trying to cut through all of that. And even though sometimes the science at this point might not answer all questions. And I think that gets frustrating to women. Like when they're talking about now testosterone has become a big part of the conversation. And it's like, well, we probably will over the next 5 to 10 years learn a lot more about testosterone and how we should dose it and how it shouldn't be. But that doesn't mean that right now at this point, everyone now should be asking for testosterone, right? And so I think if we stick with an evidence-based approach and do things that we know are safe and effective, and then continue to, support research that gets better answers, we are going to be moving forward and faster than we were in the past because there's a lot more research being done.
And there's a lot more players in the game now. And so I really like that. So anyway, I want to say thank you to Ardelle for coming on today. That was really great. We talk about this all the time.
I know.
We just literally moved our conversation from on the phone, on text, in real person to in front of all of you now. So I really appreciate you coming on. Now, Ardelle was a bit reluctant to be a social media queen. But I totally pushed her that way now. She had a private account and I was like, you've got to open that account.
Oh, it was so frightening for me.
I know. And I get that.
But I'm out there now.
But she's out there now. And so where can people find you if they do want to follow you?
Yes. So my Instagram is Dr. A. Piper, Piper.
Okay.
And I have my clinic in Ottawa for people who are being sent to me for an actual medical consultation. I am seeing people now all across Ontario. As the government starts to address these problems, like COVID made it very obvious that it's a problem if you have physicians licensed in one province and they can't work somewhere else. I think over the next couple of years, that's going to start opening up.
Right.
And so hopefully I'll be eventually able to, treat people in other provinces as well. But right now it's Ontario.
Yeah.
Yeah. But I mean, we're trying to put stuff out there all the time because again, it's one of these things where I'm not the hero of menopause. So many women need help. And so a big part of my Instagram, of both of our Instagrams, is to say, where can we direct people so that they can get the information and start the conversation they need to have with their doctor where they are.
Yeah.
And that is how this grassroots movement of menopause, I think, is really exciting.
Yeah. And it is a grassroots movement, and that's what I've seen happening. And so it's really great. And I actually also find that within this space, it's just been very welcoming and open for the most part. I found it to be like a really great environment.
I haven't had any haters yet.
I have.
You have.
I have. I've got tough skin. It's fine. Yeah, I don't actually want any. It just happens. I try to be fair, but I mean, some things sometimes get misinterpreted and whatever.
It's the nature of the beast, though, too, right? Anyone who's getting into social media has to have some perspective of just ignoring certain noise.
You can't reach everyone all the time. And so that I'm fine with that too.
Yeah.
Anyway, thank you for coming on. And thank you everyone for listening this week. And I'll see you next time. Bye.
Thank you so much for listening to the show. If you like what you hear, then why not subscribe to this podcast and leave me a review? You see, when you do this, it helps to raise the profile of my show and attract new listeners. And it also allows me to continue to deliver valuable content with great guests. And in return for you doing that, I will send you my 12-week core-focused program called Abs on Fire as a thank you. Simply drop me an email at amanda@amandasteve.com and I'll wing that your way. Bye.